Hi everyone, my name is Jānis Lezins. I'm board certified neurosurgeon practicing neurosurgery in Riga, Latvia. And today I want to speak about the increasing number of patients coming to us to have a surgery with us here in Riga, Latvia, which is EU member state. And why are they coming over instead of having surgeries at their home country? So the problem everywhere, and especially in Western Europe, is waiting lists. Let's imagine he or she, someone, is having a surgical problem. He or she is suffering for quite a lot of time. His or her quality of life has been severely affected. He or she goes to see surgeon locally, and after investigations, MRI scans, etc., everything that needs to be done to find out what's the problem, he or she learns that there is a need for surgery, for spinal surgery. However, waiting lists for spinal surgeries can be up to sometimes several years in some countries. In countries like Ireland, United Kingdom, Germany, Austria, Sweden, the situation is very similar. There are lots of patients in need for the surgery, and the surgery is covered by the state. But the problem is that the capacity of the system is not allowing them to have surgery within a reasonable time frame. This is why some of the patients are starting to look for the opportunities to have surgery elsewhere. And since Latvia is a EU member state, lots of patients, especially from Ireland, especially from Austria and Germany, are leveraging so-called EU cross-border healthcare directive. What it is? Basically, this means that patient can have a surgery in other EU member country and get reimbursed for the surgery at his or her country. So in practical terms, how can someone come over to us and have a surgery with us here in Riga, Latvia, especially from EU countries? The process is quite straightforward. The patient is contacting us by using a link which is added in the description of this video, or by email. We arrange an online consultation where we establish the diagnosis. During the consultation, we learn about the complaints and symptoms of the patient, and we review images of the patient and establish diagnosis. If patient indeed needs a surgery, and if patient agrees to proceed with the surgery, we set up a date for the surgery, and patient arrives for the surgery. Patient arrives day before surgery, and we do all the necessary workup for the surgery, including blood tests, chest x-ray, etc., whatever is needed to be done to be ready for the surgery. Sometimes it's even MRI scan which is needed to be updated, since patient's last MRI scan is for a couple of years old. So we do surgery, and patients stay with us for 1, 2, or 3 nights after the surgery. We tend to make all the surgeries minimally invasive technique, which means the surgery is quite easy to be tolerated, which means small incisions and easy to recuperate after surgery, which also means that patient can leave hospital next day or in 2 to 3 days after the surgery. We usually ask patients to stay around in Riga for a couple of more days, so they are on the radar if any early complications arise, so they can come and see us again. However, that is very rare. After this period of time, patients can depart back home. So when they come over, usually patients invest their own money for the surgery, but we provide all the necessary paperwork, documents and support so they can apply for reimbursement at the state country. This documentation includes discharge letter which states the diagnosis and procedure which has been made, all the payment and agreement related documentation. if patient needs any special paperwork, we also can arrange that. And once patients are back home, they can apply for reimbursement and get their money back. So what is the benefit of coming over to Latvia and have a surgery with us? The benefits are quite clear. You can have a surgery with us with literally no waiting list. So as long as we establish diagnosis, we can set up day of surgery within 2 to 3 weeks time, which will allow you to come over, to buy tickets and come over. At the end of the day, patient is not investing his or her money. Of course, money needs to be paid up front prior to surgery, but then the money is reimbursed by the state. For example, Germany, Austria, Ireland, Sweden, we have patients from those countries. And actually we are operating in the setting of the private hospital, which provides an additional layer of comfort comparing to the state hospitals. So if you are struggling with spinal problem which requires surgical intervention and if waiting lists in your home country is very long, you can contact us and use a link in description below. We will be in touch. We will speak to you over the video consultation. And if everything matches, if indeed you have a surgical problem in which we can help, we will be offering you a surgical treatment and we will see each other in person here in Riga, Latvia. Thank you for watching and please subscribe to our channel. We are trying to provide as much as possible information on the conditions that we are treating.